And so if you're a doctor who is taking care of Medicare fee-for-service or traditional Medicare members, then this is going to affect you whether you're paying attention or not. And today we're going to be talking with Michael Kopko and Ankit Patel from Pearl Health. You can go to pearlhealth.com, and they're going to help us understand what this is, why it's around, how it applies to your practice directly, how your patients, how it impacts your patients, and then walk us through some of the nuances and finer points of what you guys do and what is direct contracting.
You know, for many physicians, we know that we're operating in a world where you're on an assembly line, you walk into the office, in the waiting room, there's already kind of patients that are lined up, and it feels like you're just sort of trying to, tread water, keeping up with all the patients who are coming in who need care. And physicians are operating in this world where, in order to kind of generate cash flow, they have to do these 10-minute, 15-minute office visits for which they bill services. They earn probably $83 on average, what we see in Medicare, for seeing a patient for 10 minutes. Once you can get to a model where the doctor is not dependent on having to do, again, these $83, 15-minute office visits where I'm kind of just churning on an assembly line and kind of moving through my day as quickly as possible. But now I've gotten some revenue stability. I got kind of a fee that's coming in. I can now dedicate my time, my resources to the patients who are most in need.
And Michael, part of it, and the doctors listening in, we think that this model not only enables a better, allocation of our resources as a country, but that attention part that Ankit mentioned is very important. That, in the current fee-for-service model, often to get attention, you have to keep escalating your costs so that you get the right physician and facility engaged. And we think that primary care layer has the opportunity to give attention and, frankly, deliver great outcomes when it matters most, but it's actually the payment model and the alignment that prevents some of that. So we're really excited about this new shift. And, this is a true change that's coming to the primary care practice of medicine as we know it. I think more importantly, though, physicians are eager for a change. The treadmill of the primary care job is a little bit exhausting, and it doesn't really enable them to practice the things they were trained to do in medical school. And even prior to that, in terms of their career goals, it's become a little bit of a game around generating that next billable unit. And we're very excited to kind of liberate primary care physicians and other physicians who are similarly minded so that they can practice humanistic, holistic healing, and that they don't have to trade off economics as a result of that.
And so we need more doctors being for their patients, for their communities. And certainly this is an innovation that we're proud to see. We're happy to see. I know that many doctors will be very filled. That knowledge gap is now filled, and they can make a decision. And our guests today have been Ankit Patel and Michael Kopko of Pearl Health. Go to pearlhealth.com. Go check out the analysis. Gosh, it's free. Just call them. If you got more questions, call them, email them, connect with them. They're happy to do it. So, gentlemen, you've certainly brought a lot of joy to us, a lot of joy to, I think, a lot of the physicians listening. Thank you so much for being our guest here today.